Hello. In this video, I'm just going to go over some of the specifics and general information around this training program. So the program consists of undertaking 40 activities known as learning experiences. The majority of these are done with a collaborator, meaning that you do the activity yourself and then you discuss your experience, reflections, and goals with a collaborator to receive feedback. The collaborator should be a peer with experience in this area. For example, you may choose to deliver education to a group of registered nurses in your facility. You will prepare the education and deliver it. Your collaborator would ideally be a senior nurse or manager who was present and who can provide expert feedback on how you performed. If you are developing a new guideline for your facility on medicines administration, I would expect a health professional, particularly a pharmacist, who has also created a guideline and can provide valuable feedback. Although the program is designed to be flexible for individuals, there are a number of requirements that must be met if you are pursuing recognition through ANZCAP or the Australian and New Zealand College of Advanced Pharmacy. So completion of this program requires you to be self-motivated. This is challenging for us as adult learners as we have many competing priorities in our social and professional lives. I strongly suggest actively engaging with your peers, either through Facebook community groups for pharmacists, the WhatsApp group that I've set up associated with this program, or any other local health networks or local networks of pharmacists working in aged care settings. Your primary health network might be able to help you identify other pharmacists nearby and would be an excellent resource. When starting the program, there are some essential activities that you should begin with. Firstly, ensure that the aged care home where you work is aware that you are undertaking this program and is supportive of it. This can help keep you accountable and ensures that they are aware of you undertaking a professional development program designed to upskill you. Although much of what you do should be part of everyday practice, ensuring that your organisation is supportive of potential additional workloads will help you to set aside dedicated time to complete learning experiences, and they may even help you to keep on track. Next, you should identify a mentor. The documentation of mentor meetings, at least 4 across the program, is a core component of the program. I suggest that you identify your key goals professionally and consider what sort of professional can help you to achieve these goals. For example, you may have an interest in research or government policy. As such, you may identify pharmacists with experience not only in aged care settings or care for older people generally, but in these specific areas, and reach out to them directly. It is your responsibility to identify a mentor and to liaise with them. People typically are very willing to give up their time to support a peer, but of course, please be respectful of their time and the expertise that they are providing to you. The next step I suggest is to map out your plan for completing this program. As I said, it is self-directed and does require significant self-motivation. I have set up as many supports as possible to help you do this, and one of these is a number of roadmaps suggesting how you might be able to complete the process within specific timeframes. If you go to the PDF document of this training program, be realistic and select one of the example roadmaps. Follow that, you should be on track. The idea is not to do this as fast as possible, but you also need to be mindful that learning experiences are generally only valid for a period of 5 years from the ANZCAP perspective. I suggest beginning early, focusing on ways to integrate the program into your usual practice and being consistent. Before starting in earnest, I also suggest that you begin early to identify research projects that are feasible and of interest to you. The research project is a key component of this training program, and it can often seem very daunting, but I would like to clarify some aspects of this. Firstly, completing the research component of this program involves participation in research by making meaningful contributions, not entirely leading a research project yourself. And it also involves contribution to writing a research manuscript, not writing an entire manuscript completely by yourself. Importantly, the manuscript does not need to be published. It just needs to be completed to an acceptable standard. You have a range of options, including joining an existing research project, collaborating with colleagues to undertake a project, or undertaking your own project. There are many forms of research, and there are various resources and links associated with this program to help guide you. What I would really like to emphasize is that research is not just a large systematic review or randomized controlled trial. A well-structured quality improvement project or drug use evaluation is research, and this is feasible with the right support to do relatively solo. If you would like to get involved in existing research projects, which I would strongly suggest, you could reach out through professional or social networks. Read publications that are of interest to you and reach out to the authors to see if they have similar projects that they could use assistance with. Reach out to university departments to see if there are projects you might involve yourself in. Post in social media groups to see if PhD students or other researchers are looking for assistance. Involving yourself in this way can open up many doors into academia and expand your scope of influence into broader settings, and it can be quite an exciting way to use your skills to contribute to clinical practice or the quality use of medicines at a higher, more systemic level. And the next step is to just get started. So take a look at the other videos for descriptions of learning experiences. Have a look at the PDF document and the other information that I have available, and please reach out with any queries that you might have. Thank you.